Gingko biloba is perhaps the most widely studied and commonly used integrative therapy for supporting cognitive function. The Gingko extracts have been shown to reduce the oxidative stress, decrease inflammation, improve microcirculation, modulate neurotransmitter activity, and promote neuroplasticity. Animal research suggests the Gingko can stimulate the neural stem cell proliferation and activity. Numerous randomized control trials, systematic reviews, and meta-analysis have concluded the Gingko, usually at a dose of 120 to 240 milligrams per day, can slow the cognitive decline and can reduce neuropsychiatric symptoms such as delusions and depressed or anxious mood in patients who have mild cognitive impairment and dementia. Expert consensus found the evidence of the efficacy and the safety sufficient to be able to recommend standardized Gingko extract alone or in combination with conventional therapies for the treatment of mild impairment and dementia. Bacopa monnieri is a plant with religious, cultural, and medical importance in India. It's been used in traditional Ayurvedic medicine for centuries. The Bacopa extract has demonstrated effects such as reducing the brain's oxidative stress, modulating the neurotransmitter activity, reducing beta-amyloid deposits, strengthening the neuronal connections, and increasing the cerebral blood flow in preclinical research. Human research suggests the Bacopa can also improve the stress response. And furthermore, in mice, the Bacopa extract increased brain levels of brain-derived neurotropic factor. A meta-analysis that included data from 518 subjects in 9 randomized control trials concluded that Bacopa has the potential to improve some of the aspects of cognition. In one randomized control trial, in 54 participants aged 65 and older, those who received 300 milligrams of Bacopa extract daily for 12 weeks had better cognitive performance and reduced symptoms of anxiety and depression after 12 weeks when compared to those who were receiving the placebo. 2 clinical trials using different herb nutrient combinations with Bacopa have reported cognitive benefits for the treatment with these supplements in older adults who have mild cognitive impairment. Huperzine-A is a biologically active compound and it's found in the Chinese medicinal herb Huperzine-A. Huperzine-A has been shown to inhibit acetylcholinesterase, and this is an enzyme that breaks down acetylcholine. Acetylcholine is a major neurotransmitter in the autonomic nervous system, and its accelerated breakdown by the acetylcholinesterase is thought to contribute to age-related cognitive decline and dementia. Some anti-dementia drugs also work by inhibiting the acetylcholinesterase, and Huperzine-A has been proposed to have a disease-modifying effect in Alzheimer's. In addition, the preclinical evidence suggests that Huperzine-A might reduce oxidative stress, prevent beta-amyloid plaque accumulation, and the phosphorylated tau accumulation, support mitochondrial function, and increase brain production of nerve growth factor. Numerous clinical trials have shown Huperzine-A can improve cognitive function in people who have dementia. One meta-analysis included 10 randomized control trials, and it evaluated the effects of Huperzine-A in doses ranging from 100 to 400 micrograms per day, in a combined total of 825 patients with Alzheimer's or vascular dementia. The results of the analysis indicated that Huperzine-A can improve the cognitive function in dementia patients, and the longer use might result in greater benefits. Another meta-analysis of 20 randomized control trials in Alzheimer's disease patients also noted the likely benefits of Huperzine-A for cognitive function. One preliminary trial examined the effects of the Huperzine-A on task switching, a higher order cognitive function in patients with Alzheimer's disease, and after 8 weeks of treatment with 0.2 milligrams of Huperzine, the cognitive function and the performance on the task switching tests improved. In another preliminary trial, A supplement containing Huperzine-A and curcumin improved the cognitive performance in people with dementia, as well as those with mild cognitive impairment. It should be noted that mild adverse side effects such as digestive upset and constipation, dizziness, slow heart rate and dry mouth have all been reported by people taking Huperzine-A. Acetyl-L-carnitine is a form of the amino acid carnitine, and this is produced in the mitochondria, and it's involved in cellular energy production. One study reported progressively decreasing blood levels of acetyl-L-carnitine in subjects on the spectrum from no cognitive problems to subjective memory complaints to mild cognitive impairment to dementia. Preclinical studies suggest the acetyl-L-carnitine might preserve brain mitochondrial function, reduce oxidative stress, inhibit inflammatory activity by the microglial cells, and improve dopamine signaling in the nervous system. A meta-analysis of randomized control trials that included data from 21 studies with over 1,200 subjects found acetyl-L-carnitine supplementation for 3 months or longer was associated with clinical improvements in patients who had mild cognitive impairment and early Alzheimer's disease. One clinical trial in elderly participants found that the treatment with acetyl-L-carnitine led to decreased physical and mental fatigue, and it improved cognitive and physical function. A comparison trial found acetyl-L-carnitine worked slightly faster than Prozac and with similar efficacy for improving mild depressive symptoms in elderly patients, an effect that might be associated with better cognitive function. A combination supplement containing acetyl-L-carnitine and B vitamins, vitamin E, and other amino acid derivatives taken for 6 months improved cognitive function in the participants with mild cognitive impairment related to a placebo. Magnesium L-threonate is a form of magnesium, and it's found to be particularly effective for raising the brain's magnesium levels. Increasing the brain's magnesium levels enhanced neuroplasticity, and it improved cognitive function in research animals. Supplementation with magnesium L-threonate has been shown to prevent age-related loss of a specific neurotransmitter receptor on the NMDA receptor, inhibit inflammatory signaling, reduce amyloid plaque formation, preserve neural connections, and protect against memory loss in animal models of aging and Alzheimer's disease. Other animal research suggests the magnesium L-threonate might augment the cognitive boosting effects of mentally and physically stimulating activity in mice with Alzheimer's-like brain pathology. Polyphenols are a family of strong oxidative stress-reducing compounds, and they're found in plants. It's thought the high polyphenol content of traditional Mediterranean diet might be an important reason for its cognitive benefits. In 652 dementia-free subjects who were aged 65 or older, those with higher urinary polyphenols, which indicated a higher polyphenol intake, had less cognitive decline during 3 years of monitoring. Another study in 447 older adults with increased cardiovascular risk, it was also noted there was better cognitive performance in those with the greater urinary polyphenol concentration. In addition, the intake of specific polyphenol-rich foods like olive oil, coffee, walnut and wine were independently linked to better performance on tests of certain aspects of cognitive function. Evidence suggests the polyphenols can reduce the brain's oxidative stress and the neuroinflammation and improve cerebrovascular function. In addition to quenching the excess free radicals, the polyphenols might affect signaling that's associated with aging, preserve neural stem cell activity, promote neuroplasticity, reduce protein accumulation, induce epigenetic changes in the genes involved in synaptic plasticity, and support a healthy gut microbiome. Blueberries and their polyphenols, especially the anthocyanins that give them their colour, might have preventative effects against chronic diseases, including cognitive disorders. Studies in older adults have shown that blueberries can enhance the cerebral blood flow, and they can increase the brain activity in regions that are associated with age-related cognitive decline. In a randomized control trial of 37 people between the age of 60 and 75, taking 24 grams of freeze-dried blueberries, equivalent to 1 cup of fresh blueberries every day for 3 months, led to better cognitive performance when compared with a placebo. Another control trial found 24 weeks of a treatment with whole fruit blueberry powder improved the cognitive function in elderly adults. In a placebo-controlled trial in 26 patients, taking 500 milliliters a day of blueberry juice at least 14 days before surgery resulted in reduced cognitive deficits that were associated with anesthesia. In a controlled trial in 40 healthy subjects aged 50 to 70 years old, taking a mixed berry drink for 5 weeks improved the cardiovascular risk markers as well as the performance on memory tests when compared to a placebo. Grape polyphenols like quercetin, lycopene, resveratrol, and anthocyanins have demonstrated neuroprotective actions. A randomized control trial in 111 healthy older subjects found 250 milligrams per day of grape extract improved the scores on cognitive tests after 12 weeks. Older adults with cognitive decline and mild cognitive impairment experienced improved cognitive performance after drinking 15 to 20 ounces, depending on the weight, per day of grape juice. In a small placebo-controlled trial of 10 participants with mild cognitive decline, those who received the placebo exhibited a significant diminishment in their metabolic activity in regions of the brain that are involved in dementia, but those who received the grape extract had no such decline. A randomized control trial in 215 healthy older adults identified a significant effect of a high polyphenol grape plus blueberry extract taken at a dose of 600 milligrams daily for 6 months, only in those with the lowest cognitive test scores at the baseline. Resveratrol is a grape polyphenol and it's found especially in red wine, and it was shown in numerous studies to have a powerful free radical quenching capability. The resveratrol appears to slow the cognitive decline by regulating age-related signaling, improving cerebral blood flow, and increasing neuroplasticity. Findings from clinical trials have been mixed. A meta-analysis that included 10 randomized control trials found the resveratrol may improve some of the aspects of cognitive function and mood in older individuals. In a randomized placebo-controlled trial in 46 healthy individuals aged 50 to 75 years, 26 weeks of treatment with 200 milligrams of resveratrol per day led to a better performance on memory tasks, as well as an improved glucose metabolism, indicated by a lower hemoglobin A1C, increased neural connectivity, and decreased body fat. Another trial in 40 patients with mild cognitive impairment found 26 weeks of treatment with 200 milligrams of resveratrol per day resulted in better glucose metabolism and better preservation of brain structure, but no difference in cognitive function when compared to a placebo. In a controlled trial in sedentary, overweight older adults, 1,000 milligrams of resveratrol per day improved the psychomotor speed, but not the other aspects of cognitive function, after 90 days, while 300 milligrams per day had no effect. In a controlled trial in post-menopausal women, 150 milligrams of resveratrol per day improved the cerebrovascular function and the cognitive performance after 14 weeks. The investigators proposed some of resveratrol's effects in this population were due to its phytoestrogenic action. For more on age-related cognitive decline, continue on the series, or for information on herbs, supplements, and natural treatment plans, check out my website.